Well, September is National Awareness Month for prostate cancer, and joining us today, we have got Dr. Sandra Harrington. She is radiation oncologist with Mercy Health St. Rita's, and thanks for joining us today, Doctor.
Good morning.
Okay, so let's tell us more. What are the risk factors? What do men need to be aware of when it comes to prostate cancer?
Well, first and foremost, overwhelmingly, the main risk factor for prostate cancer is simply being a man. The body's testosterone level drives the prostate, continuously stimulates it. And once a male goes through puberty, through the rest of his life, the prostate is being constantly stimulated, similar to how estrogen can cause breast cancer. Now, family history can play a role in increasing risk. Somebody with brothers or father with prostate cancer, we do know they are at increased risk. Also, some genetic factors are known to increase the risk of prostate cancer. The BRCA genes that we think of as being related to breast cancer and ovarian cancer also can be linked to prostate cancer. Environmentally, taking testosterone supplements or anabolic steroids can increase the risk, but the main risks have to simply do with being male and the family history.
Okay, so are there certain symptoms then that they should be looking for? Are there signs that something's up and it might be cancer?
Mm-hmm. So ideally, a prostate cancer is detected before there are symptoms. Oftentimes, when you have symptoms from a cancer, it's more advanced. Most men are diagnosed because they have a PSA, prostate-specific antigen blood test that is elevated for their age, leading to biopsy. For all men, the prostate will gradually enlarge with age, and so some symptoms related to prostate enlargement can at times lead to the diagnosis, such as slowing of the urinary stream, difficulty urinating, not being able to empty the bladder. But for most, it's not causing any actual symptoms when it is diagnosed.
Okay, so if they got the diagnosis that they have prostate cancer, what kind of treatments are there?
Some prostate cancers are very low risk. They may sit there for years and not do anything. Others are much more aggressive. And so we stratify based on the risk of the cancer. That is a combination of what was the PSA at the time the cancer was diagnosed, and also what's called a Gleason score. That is a way of a pathologist looking at the cancer under the microscope and applying certain rules that give an idea of how aggressive an individual prostate cancer is. So based on the risk, the treatment may be a recommendation for just watching. For most men, surgery is an option, and oftentimes the preferred option. The surgery is much better than what it used to be. In the last 15 or more years, we now have robotic surgery, which is much, much less invasive, less traumatic to the body than the standard surgery used to be. In particular, for younger men, surgery is a very good option. The other thing is that if surgery is the first thing or the initial treatment that's done, there is an option for doing radiation therapy as salvage treatment if for some reason the surgery is not successful in eradicating the cancer completely. Radiation therapy in and of itself is also an option, and like surgery, our technology has improved dramatically over the last 20 years, so that a treatment course used to be 9 weeks. Now it may be at most 5.5 weeks, and in some cases even just 5 treatments given over a couple of weeks. And this is largely because of improvement in our technology, allowing us to target the cancer better, which in turn allows us to spare or protect the surrounding normal tissues much better. There are some people in whom the likelihood is so high that surgery would fail to remove the entire cancer that their better option may be a combination of radiation therapy and a type of hormonal therapy, which suppresses the testosterone level in a male, which in turn suppresses the cancer. Also, additional things that help us to protect normal tissues. There's now a gel. It goes in instantaneously when the two components mix. It creates a jello-like substance. It's biodegradable, so it disappears after 3 to 6 months. But we can put that in the space between the prostate and the rectum to give us more room to much, much better protect the rectum. That in and of itself is one thing that has allowed us to come up with these treatment regimens. There are as few as 5 treatments for gentlemen. It is imperative that when we're doing that, we are adequately respecting the surrounding normal tissues and how they're able to deal with the treatment.
Wow, fascinating to hear about this technology. Thank you very much, Doctor, for joining us today.
Absolutely. You
right.
take care.
All right, don't go away. Need Edition continues in a moment.